is Jones, and today I'll be demonstrating my skills on inserting IM and sub-Q injection. But before I start, I'm going to be showing my location sites on my partner, Alicia. Alright, for sub-Q, you want to put your injections in your fatty area. So one site would be the back of the arm, back of both arms, you could do both. Now, you also have below the scapula, your lower back. In the front, you have 2 inches away from your umbilicus. Now for your IM. IM, you want to find, you have your deltoid. For your deltoid, you want to find your acromion process, flip, your hand form a triangle, and your injection would be right there. Right there. Alright, now for your IM, you also have dorsogluteal. Dorsogluteal, you want to ask the patient to bend their leg. You're going to find the greater trochanter, put your on the greater trochanter, and then the iliac crest, and then also form your hand towards the ischial spine, and your injection would be in that triangle that you form. Now for ventral gluteal, you would put your palm, your heel of your palm on your greater trochanter, form a V, and your injection would be right there. Also, now you have your vastus lateralis. Vastus lateralis, it'll be your hand. You could place your hand above the patella and on the greater trochanter, and imagine an imaginary line running between those 2 sites, and you could put your injection on either side of the imaginary line. And those are your sites for your IM and sub-Q. All right. Now I'm going to enter my patient's room. All right. Hi, my name is John. Today I'll be your student nurse, and today we're going to be doing your injections as ordered. You have an IM injection. IM meaning that it's going to be going into the muscle, and sub-Q, that means that it's going to be going into your fatty tissue. But before we start, can you verify your first and last name for me? All right, your date of birth. Okay, do you have any known allergies? No? Okay. All right, I need to perform hand hygiene. Provide privacy for the patient. Okay. The doctors, the MAR is showing 0.5 milliliters of IM using an ampule. So for IM, I'm going to be using my 3 milliliter syringe, also 23 gauge, 1 inch needle, and then I'm going to be using my ampule. My vial, I'm sorry. For IM, the order is asking for a vial, okay? And on the vial, you're going to be checking for the expiration date, okay? This expires 2020. Also, I want to clean the top of my vial. I'm going to set up. And then for IM, I'm going to need 0.5 milliliters, so I'm going to drop back about 0.5, a little bit above the 0.5, a little bit more than 0.5. Okay? I drew back about 0.7 amount of air. Okay? Make sure that there's no air bubbles. And 0.5. Safely recap my needle. And scooping. Alright, now I need to set up my sub-Q. For sub-Q, I'm going to be using an ampule. And how I'll do that is Also, I'm gonna need a filter straw for this one. Alright, and here I want to make sure that all our medication is on the bottom. Break the neck away from me. This goes into the sharps container. Alright, also I'm going to need 0.5 milliliters. Okay. Now that I have my 0.5, I could remove my straw. Apply my needle. Now, before I go on to actually getting my injections, I need to wash my hands, put on my gloves. Alright, for my IM, since it's 0.5, I could give it into my deltoid. And since for the purpose of this video, we're not going to be actually injecting the medication into my bean bag here. Alright. So for my IM, like I said, I'm going to be doing my deltoid, find the Krumman process, and then one darting motion at a 90-degree angle to remove my. Also, for my IM, I was supposed to clean the site with an alcohol pad and allow time to dry, and then apply pressure, and then put on a Band-Aid. Now I'll also have to dispose this into my sharps container. Now for my sub-Q, I could put it in any fatty tissue area. Okay. I would clean the site. Allow time to dry. Okay, now insert, remove, apply pressure, and then put on my Band-Aid. Alright, dispose into the sharps container. Remove my gloves. Wash my hand. Alright, now I need a document. I need a document that I did give my IM and my sub-Q, sign,